Well, if you ever had to stay in the hospital, you know the feeling when the day comes when you get to go home.
And you probably don't want anything to come in the way of getting home as soon as possible, even something as simple as picking up your prescription on the way. Luckily for St. Joseph patients, they don't have to worry about that. And tonight I'll show you how the hospital is teaming up with Walgreens for its new bedside delivery program.
So, Mr. Tallent, we have here for you a pain medication. It's going to be the hydrocodone with Tylenol on it.
Delivering drugs to patients in need. That's the idea behind St. Joseph and Walgreens' bedside drug delivery program.
It's another inconvenience to drive out of the way after you're in pain.
That's why St. Joseph patient Will Tallent decided to take advantage of the service the day he goes home.
It was extremely simple. She basically just came in and asked for, the compensation, and then they kind of showed up.
Pharmacy techs take the filled prescriptions from the store and bring them straight here, directly to the patient's bedside.
What we would do is get a registered pharmacy tech to come by, talk to the patient, understand as to whether or not they would like Walgreens to fill their prescription for them, and before they actually get to go home, to actually bring that to their bedside and give them the opportunity to talk to a pharmacist if they needed to.
Hi.
A conversation Will took advantage of from his hospital bed.
We hope to help the hospital prevent readmittance back into the hospital with stays that are not necessary, and eventually curb healthcare costs by doing that as well.
But for patients like Will, it's all about convenience.
It just makes the two a lot more cohesive and gets some steps out of the way.
And helping patients get well again. St. Joseph started working with Walgreens for this program in September, but other hospitals across the country have been using it for a couple years.